right, welcome to Duke Spine Institute's live spine surgery broadcast. It's July 27th, 2023. We're performing 2 cervical disc herniation surgery. Injection. Our patient has herniated disc at C5-C7, causing symptoms like pain in her neck and down into her arm symptoms. She did not want a fusion. She wanted a more advanced surgery, so here we are performing the Duke laser disc repair. This surgery is a endoscopic surgery done through the front of the neck with a 4mm incision. Shot. Things are blocking. We got to stop. I don't know what you want to do about this. Shot. They're just getting in the way. Shot. All right, we have our guide wire in. 2, 3, 4, 5, 6, 7. Is that my shot there? We start by placing a spinal needle and a guide wire. Shot. And then we advance the dilator down over the guide wire. Shot. The guide wire is at the back of the disc at 6-7. I'm going to pull it forward a little bit. Shot. You can see the dilator moving down. Shot. Shot. You can see the herniation at the back of 6-7. Show us that. Shot. Yeah, outline it. See that pointy thing? That is the disc herniation. Okay? Like a spike going backwards. We're doing this surgery for a few reasons. Number one, the herniations are causing symptoms like neck pain. All right, AP. Also, radiculopathy, which is dysfunction of the nerve. That's very nice. Look at the dye there off to the sides. Jordan will show you the dye is leaked out of the disc. It's extravasated out by the nerve root on both sides, surrounding the nerve root and the herniation. All right, shot. Let's take a mallet. You giving me a little extension? We're going to go through the front of the disc now. Very nice. We're going to go all the way to the back. Shot. Let's go ahead and show our audience how does a herniated disc actually cause neck pain.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. Shot. All right, that's pretty much perfect. So our tube is right at the back of the disc, right where the herniation is. Shot? Yeah, I like that. Can you show us the tube there on the x-ray, Jordan? Can you guys see this?
Yes, we can.
So we're in the front of her neck. Get that fluoro out of there. She's looking up. She's got a tube in her mouth and a tracheal tube, ventilating. We got a 4mm incision, and we're going to do the whole surgery through that tube. Show us the x-ray there, Jordan. Show us where the tube is. You ready? Can you guys see that, Henry?
Yes, we do.
And that tube is at the back of the disc at 6-7. What is it?
You want to buy some? Oh, I need a.
No.
That one here, the correct one. You want to take her to the laser?
I need that, there we go. There we go.
You want to take care of the laser, please?
All right. You can see how a herniated disc causes so much pain. The answer is
Get ready.
inflammation. Too slow. Way too slow. Let me know when you're ready.
Sarah,
That's better.
stop, please. Thank you.
What is it with big-chested people today?
Huh? Oh. Oh.
All right, let's try the grabber.
Yes, sir.
We use a combination of laser and pituitary to remove the herniation. Got a pretty good piece right there. We are right at the back of the disc where the herniation is. Oh, careful now, you're pushing on me. Any questions from our audience?
No current questions.
Let's show the audience how this surgery actually works.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
Okay, you see how the Duke laser disc repair works? We use a sheath or a tubular retractor, and I bring down there the endoscope where you can actually see what's happening at the bottom where the herniation is. And the tube is docked at the back of the disc, right where the hole in the back of the disc is, right there, where the herniation occurs. And that tube then allows me to bring the endoscope, and you can see the pieces of herniation like that right there. All right. Got to float them out. That's 2 pieces of herniation. There's one still there. The herniation fragments are blue. It's stained blue with a dye that we use. That dye is called indigo carmine. Very hard to get a hold of these days. We just keep going back and forth, working our way slowly sideways, using the laser to remove just the herniation and clean the tear through which the herniation is exited, right? Because you can't have a herniation without a tear in the wall of the disc. We call those tears annular tears. And that's what she has. She's got an annular tear at 6-7 and 5-6. That's where we are. We're right here at the back of 6-7. This is all the annular tear and herniation. You see it right here. What is that noise? The bag?
Yeah.
That's fine.
Can I turn on this one so everyone is?
See the tear right there with the blue stuff in it? That is the annular tear and disc herniation. This is the right foramen at C6-7. All this stuff here is combination of herniated disc, scar tissue, inflammatory tissue. There's another piece of herniation. So far we've seen probably 6 pieces. We're not done yet. We'll see more. Now, the problem I'm encountering with her is that she has also a large chest, short neck, and you know, trying to get the endoscope to do where I need it to be in order to remove the herniation. In some patients, when the neck anatomy is not so good, where their neck is short, collarbone is high, you know, it becomes really difficult to get the right angle for the surgery. It's impossible to know who I'm going to have trouble with ahead of time. Some people it's quite obvious, but others it's not so obvious. To me, she had a nice looking neck. I didn't expect that I would struggle at 6'7". Some people 6'7" is so high that it's so easy to get to. You can get down to T1. We've seen those. But generally, going from the front is limited down to C7, but some patients actually you can get down to T1. Just had to advance the laser fiber a little bit. You guys see the glass laser fiber, of course.
Yes,
A lot
we
of
do.
scar tissue. Thank you, Henry. There's a piece of herniation as well. And the herniation pieces, I have to just literally float them up. The other option is to grab them with a grabber. There's no sense in doing that if they float up on their own. A lot of scar tissue right here. See that? A little bit of a bone spur. Now, normally I leave bone spurs alone unless they're causing problems for the patient. The ones that cause problems are the ones that are in the foramen. She's really relaxed, right? What's her,
Can we check it?
yeah, because we're fighting a lot. I'm just wondering if some of this is muscle relaxer. How many twitches?
I got 0. 0
All right.
touches.
Could be. Just could be her anatomy. Her chest is big.
I gave her a big dose.
No. You don't need to give her any more. You got 0 twitches. I don't want any more. Because we're only going to fight at 6-7. And we're almost done with 6-7. Once we get to 5-6, we won't have problems. Because the chest is not so big up there. It's really just, what am I struggling with here? All right. Where's my irrigation? Huh, it's weird. It's just, there's not much. You sure the irrigation is not really good? No? There's very little here. Let's flip it. Oh, I understand. We opened the valve on the other side accidentally. So it was letting the irrigation run right through the endoscope out the other side. All right, again, struggling with her chest being so large, but we're getting it done. And people don't have to have like big breasts to have a big chest. They can have a high barrel chest. You know, we see barrel chesting in some people. Who do you see barrel chests in the most, Dr. B?
Patients with COPD, long history of chronic smoking.
COPD. Uh-huh. That's kind of what I was thinking too. I mean, that's what I think of when I think of. See all those herniations coming out? Nice. They're coming out from that tear right there. There's another one. See that come out of there? Hiding down there by the spinal cord. Come on. All right, any questions from the audience, Henry?
No current questions.
Wonderful. Great. So far, everything's going well for her. Got great visibility with the scope. Can see the anatomy well. I'm all the way off on her left foramen, getting the herniations out of the left side. Her symptoms are primarily right-sided, but we do treat both sides with the one approach. All right. Just about done with this one. More pieces of herniation. It's another piece of herniation. Grab her. So what I'm finding is this disc at 6-7 has about 15 pieces of herniation so far. That was a good one. Maybe even more, right, Luis? Just about done though. I keep moving the scope and I keep seeing more. All these things here are pieces of herniation, all these fragments. There's a big one right there. Let's get that one out. That's a big one, 5 millimeters. Remember, pinch from the side, not up and down. Okay, now we're starting to see a little more blood because, well, when you start getting the herniation out of the foramen, the little veins start bleeding. You can see we've gotten everything cleaned out except over here. So I'm going to work on this corner. It's just so many fragments. How are we doing over there, guys?
We're doing great.
Good.
Changing your irrigation, sir?
All right, fine.
This crew is ship shape.
I bet it is.
You can turn it on right now.
Scar tissue right here.
DLDR will be here.
Bone spurs. Again, struggling with her anatomy here. Trying to get up in that corner and it's just so hard. Thank you, Luis. Today was the easiest surgery today has been what's supposed to be the hardest, which is a posterior cervical decompression and fusion, right, Luis? Yeah. Turned out to be by far the easiest surgery. Just piece of advice, if you need your neck fixed, stay natural. Right?
Yeah.
All right. Can't get over any more than that. Another piece of herniation there. Grab her. She's really done a lot of damage to this disc. You can see herniation after herniation. We're up at about 22 pieces now. Let's show this piece. Light on.
Light on, please.
Come on, Henry, to this. Yeah, can you see this?
Yes, we can.
Bring the measuring thing. Tape measure. Never mind. But you can see how big this thing is right there.
Yes, we can.
It's a big, big piece of herniation. Looks like a butterfly. Anyway, that's what we've been taking out is all these herniated fragments. I think we're just about done here. Another minute. I'm actually pretty much done. I'm just looking around to make sure we don't leave anything that's significant. Here's another piece. Remember, because we didn't take the whole disc out, we don't need to do a fusion. Only when you take the whole disc out do you need to do a fusion or artificial disc. Let's flip it. Just want to make sure there's nothing else we're leaving. Yeah. Good. Looks good. There was a little foraminal herniation there. Any questions from our audience?
No current questions.
All right. So we're just about done. We're going to bring the fluoro back in, and we're going to move on to 5-6. All right.
Scrub off, please. Lights on.
Looks good. I'm happy with that. Irrigation. We'll use a little betadine developed at NASA to fight the possibility of space cooties. Let's see. Right, Dr. Berndes? Pretty cool to be working so close to NASA, isn't it?
Yeah, I actually saw, I got to see
I woke,
SpaceX launch
yeah,
from the
a
water.
couple of nights ago,
Kinda fun.
right? I could see it from my house too. That was a heck of a launch. I could feel it. Shook my whole house. That SpaceX rocket. All right, let's bring in the fluoroscope. The next level should be easier to see on the X-ray machine. What is it? It's pointing at him. You might get you might get lasered. But he's right.
Yeah, yeah.
All right, any questions?
No current questions.
So again, a little harder than we thought because this, can you guys see this here?
Yes, we can.
Okay. This is her chest, and it's really makes it difficult to work with the scope. You're trying to angle the scope to get in the foramen, and you're bumping up against these things. So, all right, shot. All right, so we're going to need to see down south a little bit. Luis, I'll need your help. And she's got broad shoulders, too. You never think about there being a difficulty here. Man, it's just not our day today, huh? Have all these difficult cases. Again, I was telling Luis our easiest surgery was supposed to be our hardest surgery today. It was a posterior cervical fusion. Shot. All right, that looks better. Shot. Very good. All right, 2, 3, 4, 5, 6, 7. All right, let's go ahead and we're going to move out. Nobody shake the neck. Keep it steady. Shot. I'm going to come out of this disc. I'm going to move north. 1 disc. Shot. We're out. Now I need to make sure I'm in the middle. AP. Nobody move. I can't let my dilator move to the side. All right, so we're a little bit off to the side. I want to bring it back. Shot. Shot. That's perfect. Now lateral. So I moved it from a little bit off to the right to dead center. Everyone holding? Now I'm going to move up just a smidgen more, like about 5 millimeters. Shot. Now I've slipped off. I need an AP. I've slipped off to the side, so I need to figure out where we are. Shot. Well, it's not too bad. Went back to that right side. Shot. Still a little off to the right. That feels a little bit better. Shot. Let's go back to a lateral view. I just got to get right over the 5-6 disc and then we can enter it. So far everything's good. I just got to get north a little bit. Shot. There we go. Shot. 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 That looks good. 2, 3, 4, 5, 6, but let's see where we are in the AP. I think I'm off to the side. That's the problem. Looks like I'm off to the left this time. Shot. Yep, off to the left. Shot. That looks good. Now if I can just make this work, give me a lateral, please. We need to double check the lateral again because I moved. So I want to go a little bit more to her right side, just a smidgen. That should be good. Shot. All right, a little bit north. Shot. Now if I could just get that, now AP, I want to make sure I have it moved to the sides again. So you got to use 2 views, AP lateral, front, back, side, side, and make sure you're, yep, perfect. Lateral view. All right, now we're ready to go in. So I'm going to use my dilator to enter the disc. Shot. Shot. Let's get an AP just to make sure that I didn't slide off. You always got to check and double check. All right, that's perfect. We didn't slide off. We stayed in the middle. Shahat. All right, perfect. Take. I'm going to pipe clean this thing and then we're going to get a discogram. Shot. Shot. All right, so I cleaned out the disc material. We're going to do a discogram. Shot. All right, you can see a tear there. Show us the tear. There's a tear right there. That's where your herniation is. We want to clean that tear and that disc will heal. Very nice. A lot of rubberiness back here, meaning a lot of scar tissue. Yep. It's bouncy, bouncy, like a bouncy house. Shot. So that's what happens with chronic inflammation. If you had a herniated disc for a long time with lots of inflammation, well, after years of inflammation, your body starts building up all this scar tissue. Shot? And that's what we're dealing with. I got to watch it carefully, a little millimeter at a time. We're going to go in a millimeter at a time. Little distraction. Uh-huh. That was better. That helped. Yep. So we want a nice and slow. That looks really good right there. Everyone, relax. Shot. Perfect. I love it. 2, 3, 4, 5, 6. We're at 5, 6. I'm going to take the fluoroscope out for the last time, do our 5, 6 disc, and we'll be done. Go, George. Come on, Jordan. Straight out. Don't let anybody get in your way.
We have a question.
Sure.
This comes from Kelly on YouTube.
Eddie?
Kelly.
Kelly.
Kelly, yes.
All right, Kelly. Happy to take your question.
They said you go through the disc from the front to get to the herniated area at the back, correct?
Uh-huh.
So
Yes.
is there any risk of doing more damage to the disc doing this?
Uh-huh. Great question, Kelly. So all spine surgery in the neck goes through the front. Every single spine surgeon and every single spine surgery goes through the disc. The difference is we don't damage the disc when we go through it. But when you do an ACDF or an artificial disc, they damage the disc. They take the whole disc out. So yes, with anterior cervical discectomy and fusion, you're going to destroy the disc so bad that they have to actually scrape the bones and then put a cage in there or an artificial metal disc. So traditional spine surgery destroys the disc, but this surgery does not. Nope. There's no damage to the disc going through it because we're using a very skinny tube. Good question. All right. So we're looking at the back of the disc right now. And you can actually see pieces of herniation, a lot of scar tissue right there. I'm using the laser to clean it up. I'm going to keep rotating my laser side to side, just removing pieces of herniation. You see a piece right there wanting to work its way out. Now the orange color stuff is calcium. So it's calcified annulus. That's what we're debriding. The white thing on the left from about 7 o'clock to 10 o'clock, well, that is the end plate. That's the normal bone. It's supposed to be there. It's got a little bone spur coming off of it, but nothing significant. This is all scarred up herniation right here. There's a piece of herniation, the blue thing. And you see how the laser just shaves it down safely. Now remember, that glass tube you're seeing right there, folks, that is 1 millimeter. Sorry, it's half a millimeter wide. All right, there's a piece of herniation right there. Just popped out. So these herniations are actually further deep than we are, and they're pushing on the nerves and spinal cord. So once we remove enough of the scar tissue with the laser, they just pop out right in front of us. They come out of where they were herniated, and we call it a reverse herniation when they herniate back to where we are. That's actually a good herniation, a backwards herniation. Right, Luis? You know, a herniation just means for one tissue to move through another tissue, to pass through another tissue or area. So what's herniating is the blue stuff, the nucleus pulposus. And it's being displaced from the center of the disc out to the periphery where the nerves are. Now that's a spinal cord down there. You guys see it?
Yes, we do.
Okay, I'll show you where it is in a minute. I'm just cleaning up some scar tissue. But that is the spinal cord right there. You guys see it right there? Down there?
Yes,
That's
we do.
called, ooh, that's called the dura mater.
Sweeper.
All right, so the laser fiber just broke. I'm going to have to get a new one. Just turned off the irrigation. That's what happens when we turn off the irrigation. I'll turn it back on. Can't use it. You guys see the spinal cord right there? Underneath all that scar tissue?
Yes, we do.
All right, we don't want to damage that. We want to clean the rest of the herniation out. So we're just preparing the fiber. That's what happens when the irrigation goes off. Everything gets cloudy. You get a little bit of bleeding, but it's very minimal. Off, on. See what a difference irrigation makes? Pretty cool, huh? It becomes a red slushy without it. All right. One time in my career, I actually broke the laser fiber in on my finger, and yeah, it's got a Brazilian booty right there. All right, flip it.
Lights off, please. Thank you.
And the fiber burned my finger. It burned a hole in my finger that went down to the bone. Of course, I made a full recovery, but I still have a scar to this day from 16 years ago when I started doing Duke laser disc repair. I guess it's more than 16. Oh, yeah. Yeah, no, it's about 16 years. I think it's going on 17 years, so. Another piece of herniation. See how the laser frees it up, and then you just float it right out, usually, if it behaves. Sometimes they're too big just to float out, and we have to grab them and pull them out. But that's a piece of herniated disc that was sitting at the back here, right on her spinal cord. You guys see the spinal cord through that little hole right there?
Yes, we do.
That's where the herniation went out, by the way. It's an annular tear. You guys see the annular fibers right there? That's annulus. And that hole right there is where the herniation was, and you saw some of the pieces coming back through it. So anytime you have a herniated disc, you have to have an annular tear. And of course, behind the annulus is what's called the posterior ligament. And that posterior ligament, I apologize, those fibers, you can kind of see them right there, are the last of the posterior ligament fibers. And the herniation usually doesn't go through the ligament. It stays to my side of it, with the disc side of it. But in this case, it went through the posterior longitudinal ligament into the epidural space. So most herniations are what are called subligamentous. Am I anywhere near the fiber? Am I good?
No, you're good.
A lot of scar tissue here. See all that orange stuff? That's calcium inside the scar tissue. that orange stuff is not normally there. It's abnormal. It shouldn't be there. It's only there because the body responds to excessive inflammation by forming excessive scar tissue. And the excessive scar tissue, of course, gets calcified in a process called dystrophic calcification. Look at all those little pieces coming out of the foramen. Again, we float them out. Stephen King would be proud of us. They float down here. Any Stephen King fans out there?
Big fan of his early work.
Huh?
I'm a big fan of his early work, like Shawshank Redemption, The Shining.
Oh, yeah.
Yeah. He has some good stuff here and there today, but it's not as impactful.
Yeah. I got to grab that piece out. It ain't coming. Yeah, Stephen King is my absolute favorite. My favorite author, storyteller, narrator of all time.
Ooh, Misery. That's a good movie.
Yeah, that was a good movie. What was that, like back, Laser?
88?
Back in the 80s, yeah. You never seen Misery? Oh my God.
It's a must.
It's frightening. Hobbling. Anybody who's seen Misery knows what hobbling means, right? What was that female? She was amazing. Bates? Wasn't
Yes,
her name
Kathy Bates.
Kathy Bates.
That was her Oscar-winning performance, actually.
Yeah, yeah. That made her famous. She was so good in that movie. Terrifying, huh?
Agreed.
Stephen King is just a master.
I heard in an interview once that he writes like 3 to 6 pages a day.
Yeah, I don't know. I will tell you this though. I went to Maine once and I saw a hotel where he kind of hang out, you know?
Oh, wow.
Uh-huh. It was so cool to see his picture and know that he was close by.
It makes sense for Stephen King to go up to Maine, get away from it all. And
Oh, he's from Maine.
oh, he is? Oh, that I did not know.
Yeah. I want to say Bangor, Maine or Derry, Maine. I can't remember which one. I think it's
Still lives there too.
yeah. I think it's Bangor, Maine, right?
We have a comment from Canes25, and they mentioned, Doc, do you remember Creep Show?
Oh yeah, Creepshow. Yeah, you're right. He was in Creepshow. As a matter of fact, I think Creepshow was his. He was the farmer. He was the farmer that got that asteroid crap on him and he turned green. Right? No, was he the farmer? He was in Creepshow. I remember that. I can't remember. I thought he was the farmer though. Yeah, he was the farmer. He was the farmer. Stephen King. He didn't just write horror, he actually loves these cameos.
Yes.
Yeah, Creepshow is scary as hell. These are all herniations, by the way, coming out. Yeah, it's Creepshow. I remember all the Creepshow stories. Anybody else know Creepshow? Great cinema.
I'm putting that on my list. Oh, and we have a question from Lucky Sevens on YouTube.
Yep, you got it. Maximum Overdrive, Carrie,
Carrie's really good.
Pet Cemetery. I mean, of course, one of his greatest, It,
Yeah.
which is amazing. And there's some they never even made, movies of. Like The Talisman, where Stephen King wrote with Peter Straub. Great story, The Talisman. And, it just goes on and on. Genius.
We have.
All right.
Yeah.
Yeah, fire away.
This question comes from Lucky Sevens on YouTube.
Lucky Sevens, welcome to our live stream. We got 5 minutes maximum, maybe 3 minutes left.
They asked, what is the recovery time from this?
Recovery is 1 hour, literally 1 hour. You can go to work tomorrow. This patient's going to go home an hour after surgery. And we are just about done. It's a fast surgery. It's a bloodless surgery. And it gives about 98% on average pain relief, from neck pain and arm symptoms. People come from all over the world to get it done. All right, just about finished here. Want to float these last little buggers out. All right, that's it. You said there's another question or no?
No current questions.
All right, we're done. I'm going to show you guys this incision. It's tiny. First, a little antiseptic. I tell people we used to use in surgery, all of our surgeries as surgeons, neurosurgeons, we always clean the wound when we're done with saline, sterile saline. And what that does is if there is any bacteria or anything that happen to find its way down there, it gives the patient a better chance of clearing it out without getting an infection. So we've always done these irrigations at the end of surgery. And I used to do betadine, but they took betadine kind of off the market. So we had to find an alternative, which of course is developed by NASA just down the road. It's bacitracin, and it's really powerful stuff, and patients don't have any problem with it.
Dilution is the solution to pollution.
Oh, don't even say that. Dilution is the solution of pollution. We're not diluting.
Back in the general surgery.
That was back in the days when people dumped
Irrigated the abdomen.
dumped shit into the ocean, like when they were dumping garbage in the ocean, or toxins in the ocean, right? No, really, it was. That was like the idea. Is, we can dump all this, cyanide in the water because it's still being diluted. That was back in the 70s, man. Yeah. All right, you guys see this?
Yes, we do.
The whole surgery done through this tiny little cut. Let me have that tape measure if you have it, or you don't. All right. Do you have any herniation? Okay, no problem. Yeah, right here. So you guys can see how small this cut is. Okay, it's about 5 millimeters. All right, that's going to get a little Band-Aid and then we're done. She's going to go home in an hour and she could go back to work tomorrow. That's how gentle this surgery is. No post-operative narcotics. The patients don't have pain bad enough to take pain pills, just Tylenol, and maybe a Robaxin if they need it, which is a muscle relaxer, but that's it. We don't prescribe narcotic painkillers. Hey, the bag is full over there. I would suck it out. All right. Type up your questions, and I'll be happy to come answer them. Everyone did a great job today. Our easiest case today was the first one, which was a C5-C7 T1 T2 fusion and decompression laminectomy with instrumentation. That was like the easiest. Positioning was hard, but the other two cervical DLDRs today were extremely difficult.
But he got complete sensation back in all his fingers. He was so happy.
Oh, good. Thank you. All right, type your questions up for me. I'll come answer them. Thanks, Henry. This was the right side, correct? I'm Dr. Arduke Majan. I'm here with one of my patients on February 1st, 2023. And you just had surgery on your neck, the Duke laser disc repair done with a 4mm incision to fix 2 herniated discs, her C6-7 and her C7-T1. And you had a long neck. We were able to get down to the C7-T1, and she had a very large herniation there. So your surgery was about 24 hours ago. How do you feel today?
I feel like a different person. I feel I was able to do many things this morning that I haven't been able to do for 4 months, and that is just get out of bed and just take my first steps and have 0 pain. And I haven't had that in 4 months. First step out of my bed was always the beginning of my day, and it was awful. And today I took my first step out of the bed and it was glorious.
Good for you. And before surgery yesterday, you had been suffering for about 6 months with neck pain going into your right arm, correct?
About 4 or 5 months.
How did that affect your quality of life?
Every day is difficult. I mean, I have a 10-year-old and a 5-year-old boy, and just the basic duties of a mother every single day was just unbearable and difficult. So quality of life was not very good. And so it is now.
And so the pain, obviously, because of the pain, activities would set it off, so you were limiting what you were doing. You were limiting what you were able to do as a mother.
Yes, there was things I were not able to do, and be the best mum that I can be was not one of them.
Well, you look very happy right now.
I am.
Why are you so happy?
Because I'm pain-free.
Yeah, and you didn't have to have a fusion or an artificial disc put in your neck, did you?
I did not.
Did anyone offer those surgeries to you?
I did. I was offered those surgeries. I was told that I needed a fusion, the possibility of disc replacement in 1 or 2 years down the road, but it was my decision to go in and have those taken care of if I wanted to. But there was also a possibility that once the doctor got in, that he could not replace those 2 discs, so he'd have to fuse those 2. So that to me was a possible 3 fusion, 3 discs being fused.
Mm-hmm.
And I know the consequences of that, so that's why I came for your opinion, in your professional opinion, what can be done in a less evasive way. Or that was an option for me, and here I am.
And I'm really happy it worked out for you. You can see in the video, we were able to get down to C7-T1, which is really a first endoscopically. And, you know, because you had that nice long neck, we were able to do it. And there was huge pieces of herniation down there. Your other disc was more degenerated, and we were still able to get that fixed as well. So I'm very happy you're doing well. What's life going to be like now that your neck is fixed?
My quality of life is just going to be a lot better than what it was. I'm going to take it easy, and I know that I need to take it easy, and I'm going to be careful, but I'm going to wake up with a smile on my face now instead of tears.
Well, congratulations.
Thank you so much.
Is there anything else you want to tell your fans out there?
Come see Dr. Duke. He'll fix your pain and make you walk out with a smile on your face.
Excellent. All right. Good to see you. Good
Thank
to see
you. Thank you so
You're
much.
welcome. Good morning, I'm Dr. Dugmajian. It's December 9th, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact.
Yes, sir.
And he's suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes,
as a matter
sir.
of fact.
Yes, Doc. Yeah.
You're here now on post-op day 1. It was outpatient, no hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, Doc. You know, I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, you know, it's just a game changer. His procedures, because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now on my back, and Dr. Dukes is going to fix it next week, so I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed, but you broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can
Yes, sir.
actually see right here in this video footage how small the incision is, tiny. and I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, Doc.
100%.
I mean, 100%. And I mean, doctor did. They did surgery on 3 different levels, and through a really small hole.
4 millimeters.
Yes,
4
Doc.
millimeters. Incredible.
And there's no stitches. It's just a Band-Aid.
Yeah.
You know, that's crazy. You know, if you have a fusion for three level fusion, I don't know how long that would be, but it's
it's
terrible.
about that long
Yeah.
for a 3-level fusion. And then of course you'll have swallowing trouble for months,
Not
and
good.
then you'll have pain, and you'll be on narcotics. Are you on any opioids or narcotics?
No, Doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Duke laser disc repair, you don't have to worry about getting addicted to painkillers, because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. And that was quite a story on that patient, but we're going to cut it short because it's been a long day here. So we just finished this lady, and we did everything we needed to do. I inspected the back of her herniation from side to side, foramen to foramen, and everything looked fantastic. We took out probably 30 pieces of herniation in the end there, some big, some small. You guys got to see a big one, right? And it was stained blue, because that's what happens when you get a herniation over time. It degenerates. You're probably not used to seeing me in glasses. I'm sure some of you are wondering, why am I wearing glasses? The reason I'm wearing glasses today is because I normally wear contacts, and when I do fusion surgeries, I wear a special kind of glasses called loupes. And basically they look like these glasses, but they have little binoculars attached, like little round things attached to the lens, so I can magnify about 2.5 times what I'm looking at down there. And I use those during the surgery. So I can't wear contacts because they're prescription loupes. So that's why I come with glasses. Anyway, this surgery went very well for this lady. I think she's going to do fantastic. We did struggle a little bit getting down to C6-7, the bottom disc in the neck. It was tough. She had, you know, a lot of tissue here that kind of pushed against the scope again. Not as bad as the last patient. By the way, the last patient's already leaving. Remember the one we had done before this one? And he's very happy. He told me that the numbness in his hands are gone. So he's very happy. Numbness is gone, pain is gone, and he was thanking me. I told him, listen, you were the hardest one I've ever done in 16 years on the cervical, and we didn't even get all the herniation. We left some of it because I couldn't get it all. But it sounds like the result is still pretty good, so I'm happy about that. He does have a little tennis elbow, which we'll fix tomorrow with a shot, but that's about it. All right, we have a question.
Just one question, and this comes from Lucky Sevens, Alternative Rock 8 on YouTube.
Nice.
And they ask,
Lucky Sevens, Alternative Rock 8 on YouTube.
Yep. And they ask, can you repair degenerative disc disease?
Yeah, can we repair degenerative disc disease? Yes. What does that mean? Well, listen, the thing people are caught up with that's really screwed up their heads is they all think that the disc has to be normal looking to be out of pain. Your disc does not need to be normal looking to be out of pain. The reason people have pain is there's a little tear in the back of the disc, and we discovered this at Duke Spine. That tear is the cause of all the pain in the neck, headaches, arm pain, all of it, okay? And if you go in there with a laser and you clean that tear and get rid of the herniation, get rid of the inflammatory tissue, get rid of as much of that scar tissue as you can, clean out the little calcium deposits. Some of the bone spurs sometimes need to be cleaned out. You do all that with the laser, with the Duke laser disc repair procedure, then the pain goes away, the symptoms all go away. Neck pain, arm pain, headaches, everything goes away, okay? The only thing that doesn't go away is facet joint pain. So we're not making the degenerated disc look normal again. It's still a degenerated disc. As a matter of fact, when you get an MRI after our surgery, you won't see much difference unless you had a huge herniation to begin with. But with degenerative disc disease, we can fix the pain and symptoms with laser surgery, the Duke laser disc repair. We cannot make your disc look normal again. It never will. And you're just going to have to understand that. But I have a degenerated disc in my back. It's literally bone on bone. It looks horrible. But I have zero pain, zero symptoms. I'm not getting it treated. There's no reason to. The vast majority of degenerated discs have no symptoms. People walk around with them all day long. They play sports, they run, they bike, they play hockey. You don't need a normal looking disc, you just need a painless disc. As in the famous words of Dr. Berndes, we don't do cosmetic spine surgery. Okay, we do functional spine surgery to get rid of pain and symptoms. Have a great night. Thanks for joining us today on July 27, 2023. We'll be back next week for more action at Duke Spine Institute.